All right, well, good afternoon and welcome to the webinar. This is hosted by the Council on Foundations, and the webinar is Philanthropy and COVID-19, examining 2 years of giving and what's next. My name is Natalie Ross. I'm the Vice President of Membership Development and Finance at the Council, and my pronouns are she, her, hers. We're so excited to be here with all of you today in partnership with two colleague organizations, the Center for Disaster Philanthropy and Candid. A few reminders just before we jump into the conversation. And so you'll see them also on the screen. You can submit questions at any time using the Q&A box at the bottom of your screen, and we will have time for questions and answers at the end of the presentation. If you are on Twitter, feel free to tweet about the webinar and what you're hearing. You can use the hashtag COVID-19 or what you see on the screen, hashtag CDP for recovery, to share and join the discussion on social media. And finally, we are recording this webinar. It will be available on the Council's website and shared with all registrants over email within the next link. Within the next week, so that you'll have it and can share it with colleagues. Live captioning is also available now on Zoom, so you can click on the closed caption / live transcript at the bottom of your screen to access the closed captioning if you need it. All right, and with that, before we begin the conversation, I'm going to pass the floor to Regine Webster, Vice President at the Center for Disaster Philanthropy, to start us off with a land acknowledgement.
Thanks, Natalie. As we begin this webinar, we want to acknowledge that we're working from the stolen lands of the many original peoples. We recognize that Indigenous peoples have been displaced and disenfranchised from their land by the socioeconomic and cultural disaster of colonialism, as well as disasters. We acknowledge when the U.S. was founded, there were exclusions and erasures of Indigenous knowledge about how to appropriately care for these lands, causing environmental destruction and degradation, which has had significant impact on disaster risk and on communities. We are committed to dismantling the ongoing legacies, systems, and structures of settler colonialism and white supremacy. We commit ourselves to understand where and how wealth accumulation has harmed people, the earth itself, and the complexities of philanthropy as connected to that truth. Despite centuries of theft, violence, and murder, this is still and always will be Indigenous land. Please join us and acknowledge the original peoples and their elders, past and present, as well as future generations.
Great, thank you for that, Regine. So last week, the Candid and the Center for Disaster Philanthropy released a new report called COVID-19, examining 2 years of giving. In today's webinar, our experts will share with us the data, experiences, and recommendations for the future of pandemic philanthropy. There are several key questions that our speakers will address today, including how have funders in the US and globally responded financially to the pandemic? What are trends in giving and how have we seen them change over time? What should funders focus on in the next few years? And what are the trends in grant-making practices that have come about in response to the pandemic? To get us started, I'm pleased to welcome Lori Burtman, President and CEO of the Irene W. and C.B. Pennington Foundation, which is Louisiana's largest private family foundation. Lori is the co-founder and inaugural chair emeritus of the Center for Disaster Philanthropy. She's widely recognized as a noted expert and innovative thinker in the field of disaster philanthropy. Following Hurricane Katrina, Lori organized local and national philanthropic resources to raise more than $40 million in funds for the recovery. Thanks to the Pennington Family Foundation for their financial support for this research and their ongoing support of CDP and the disaster research field. Lori, over to you.
Thank you so much, Natalie. I appreciate it. And thank you to the Council on Foundation for hosting the webinar. And I also want to send a big thank you to the teams at Candid and CDP for the excellent research and writing that went into this report. The Pennington Family Foundation was pleased to provide financial support for this research and other reports prior as well, and hopefully future reports. I also want to thank specifically Tanya Gulliver Garcia, who also lives in Louisiana, who provide me with these wonderful statistics that I'm about to tell you about. In Louisiana, where I live, and it's great to have an expert like Tanya along right near me. At least 1 in 4 residents have been infected with COVID-19, and almost 1.3 million cases in a state with just over 4.3 million people. At least that's 1 in 268 residents have died from the coronavirus, and over 17,000 people. So disproportionately, these deaths have occurred among Black and Brown folks. Like many places, we are seeing a surge in the cases. COVID is not going anywhere anytime soon. Only 54% of those eligible in my state have been vaccinated. And globally, 20% of people who have received at least 1 vaccination are from North America or Europe. 25 are from high-income countries. The wealthiest 50 countries have just 16% of the world's population, but have 21.4% of the vaccines. In the US, this works out to be 4.9% of the vaccines, but only 4.3% of the global population. To look at the flip side, the least wealthy 50 countries have 8.6% of vaccine and 20.6% of the population. Until everyone is vaccinated and protection is maintained, the virus will continue to mutate. But even if it went away tomorrow, the legacy of COVID's impact will remain. The disparity that the pandemic laid bare is startling, as these statistics show. It is critical as funders, we continue to fund responses to COVID, including the cultural, social, economic, and racial crises that have been made more visible. The root causes, such as issues as hunger, inequitable access to medical care, a lack of safe and affordable housing, and challenges with educational access and employment wages also must be addressed by funders. I'd be remiss also to not mention grief, complex mental health, and what we continue to learn about long COVID we need to keep our eye on. Yet, as this report from my colleagues at CDP and our friends at Candid show us, funding is decreasing dramatically. But we really do need to step up and keep our eye on this as funders. We need to expand our giving. We really do. To look at equity in all of our grant making, to be flexible with our grantee partners, and to support their ongoing operational and capacity. One specific pro tip that I would tell you as a long-term funder and fundraiser, it's a great time to sit down with your partner grantees and really look at how you can help fund them in a more creative way because of what happened during the pandemic. And this can really be some exciting and interesting conversations I'm certainly having with our group of grantees. So just on behalf of the Pennington family, I want to give thanks to Candid and the Center for Disaster Philanthropy for their continuing track of data, issuing of these reports, and such thoughtful and case studies and recommendations, so that I, as a funder, we all can make the most informed investments possible. So thanks again, and back to you, Natalie.
Great. Thanks, Lori. Your support for this work is really appreciated. In 2020, the Council and others launched a pledge outlining philanthropy's commitment to COVID-19. To date, more than 800 philanthropic organizations have signed this pledge, committing to a variety of strategies that make their funding more flexible and ease restrictions on grant-making partners. In line with this pledge, we saw funders increase their resources in direct response to COVID-19, and that's some of the data that we'll talk about today. But we also saw funders make changes in how they make their grants. Research by the Center for Effective Philanthropy explored whether these changes are temporary or might be long-term. Funder surveys in 2020 and 2021 found that since the pandemic, at least 66% of funders had loosened or eliminated restrictions on existing grants, and 57% had begun making new grants as unrestricted as possible. Similarly, 75% of foundations reported making more unrestricted grants post-pandemic than pre-pandemic. But only 50 to 60% of funders think these practices will be implemented long-term, and only in some of their program areas. I'll also note that one area we aren't seeing much change is in the provision of multi-year general operating support. So as Lori mentioned, and as the report outlines, the pandemic is far from over. We know we need to recognize that vaccine access is not equitable globally. And because this is a global pandemic, none of us are safe until all of us are safe. Globally, here and in the US, we need to address equity considerations. And as the report points out, members of Black, Indigenous, and other communities of color continue to suffer disproportionate effects from the virus. Our LGBTQIA+ friends, seniors, children, people with disabilities, and many more marginalized groups are also impacted differently by the pandemic. We know that community foundations across the US and globally serve these populations and the nonprofit groups that support them. We need high wealth individuals, corporates, private and family foundations to also provide additional resources to local communities. We've learned from CDP and others that adopting a long-term lens for rebuilding and recovery is important after environmental disasters. The same is true for COVID-19. It will take decades to rebuild our social, cultural, educational, and economic infrastructures. Rather than the declining trend in giving we see in this data, we need to look at how can we make sure that giving continues to increase. This includes recognizing that almost any funding we do in the next few years has the potential to be linked to a systemic COVID recovery here in the US and around the world. Now, let's get into the data and see what we heard and how funders have responded. So it's my honor to introduce our speakers who will share more about their and their institution's response to the pandemic. Grace Sato is the Director of Research at Candid, where she helps make sense of Candid's data and turns it into meaningful, actionable knowledge. She began her nonprofit career as a social worker, supporting vulnerable children and youth through community-based, family-focused services. As she transitioned to administrative roles, she discovered her love for data and using data to evaluate programs and inform organizational decisions. In 2011, she joined the research team at Foundation Center, now Candid, contributing analysis to dozens of publications about the sector and directing international and national research projects in collaboration with many partner organizations. Welcome, Grace. Regine Webster is the founding executive director and currently vice president at the Center for Disaster Philanthropy, where she brings a keen sense of adventure, discovery, and compassion to the fields of philanthropy and humanitarian assistance, helping to build bridges between those offering solutions and those in need. Regine shares her 2 decades of disaster philanthropy experience and speaking engagements and through volunteer leadership positions on local and national level boards and committees. Welcome, Regine. And finally, Tonya Wellins is the president and CEO of the Greater Washington Community Foundation, the largest public foundation in the Greater Washington, D.C. region. The foundation's mission is to build thriving communities by galvanizing philanthropy and investing locally to maximize community impact. Leading an organization with a staff of 35, nearly $400 million in assets under management, and $70 million in annual grants, Tonya oversees the day-to-day business of the organization, serves as chief development officer, and works with the board of trustees and staff to determine the strategic priorities of the organization. Tonya has successfully launched and led programmatic and development efforts for several key initiatives, including their COVID-19 Emergency Response Fund, Voices DMV, the Resilience Fund, and the Partnership to End Homelessness. Thank you, Tonya. It's so great to have you with us. So welcome and thank you for sharing your expertise. Grace, I'm going to pass the floor to you to kick us off.
Thank you. Hello, everyone. It's a privilege to be here. My thanks to COF, CDP, the Pennington Foundation, and the Greater Washington Community Foundation. And thank you to all of you who are joining us. I'm here to share what we've learned so far about philanthropic funding for COVID-19, especially in the second year of the pandemic. If we can get to the next slide, there's a lot in the report. It's written in a way that you can go to any chapter and read it independently. And I'm going to focus today on the first two sections, which are about the quantitative data about funding from US donors, but the report does contain data and stories about philanthropy in other countries as well. Next slide. So one question that CDP and Candid had coming into this project was how COVID-19 giving in the second year of the pandemic compared with the first year. So for background, CDP and Candid have been tracking philanthropy for disasters and humanitarian crises for the last 8 years. And what we saw in response to the pandemic in 2020 was magnitudes more than any other crisis we had ever tracked before. And so we were curious to know whether COVID-19 funding was sustained in the second year of the pandemic. And that's not an easy question to answer. Candid is still collecting data for both 2020 and 2021. And so for this, we turn to Candid's annual Foundation Giving Forecast Survey. This is a survey that we send out to the largest US private and community foundations, asking them about their grant making over the past 2 fiscal years. And in this year's survey, we also asked how much of those grant payments were COVID-19 related support. We asked for an estimate, either as a dollar amount or a percentage of their total giving. Next slide. Of the 490 survey respondents, 398 said they provided COVID-19 support in 2020. In 2021, it was 323 foundations, so that's a decline of 19% of donors. COVID donors in 2020 gave $2.1 billion. In 2021, they gave nearly $1.5 billion. So that's a decline in funding of 31%. Corporate foundations reported the biggest shifts in their giving. Among them, their COVID dollars fell by 76%, but community foundations and independent foundations also saw declines. COVID-19 support as a proportion of overall giving also fell. So giving generally increased in 2021, but not COVID support. So in 2020, COVID giving represented 12% of all grant dollars. In 2021, it went down to 7%. So you can probably anticipate some of the challenges of quantifying COVID-19 support. We got questions, we saw write-in responses that survey respondents were defining it differently. So for example, one respondent indicated that none of their grants were COVID support, but they were prioritizing stabilizing their grantees. They were renewing general operating support to almost all of them, but they didn't count that as COVID support. Whereas another respondent indicated that 95% of their funding was COVID related, and they explained that they made almost all of the grants operating support, general operating support, rather than project support. But from what we can tell, that was rarer to see. It wasn't happening as often that funders were broadly defining COVID-19 as like making up the majority of their giving. So we recognize there's no standard definition, and we took the approach that funders can define it however they want to. With the survey, we weren't interested in comparing funders with one another. What we were more curious about is how funding changed from one year to the next. And those trends were pretty clearly indicating that funding went down in 2021, whatever your definition was. Next slide. So next we turn to Candid's database. So since 2020, Candid has been scouring public news sources, scraping website data, trying to get a picture of what's been announced about funding for COVID-19. In addition, organizations like the Greater Washington Community Foundation have shared their data directly with Candid, and that enables us to see data far sooner than waiting for the IRS to release forms 990, 990PF, which would typically be our primary source of data. But it can take as much as 2 to 3 years for IRS to make that data available. So this analysis makes sort of 990s don't play as much of a role in this data set. So we know that it's incomplete. All we can say is that this is what we know about the funding data so far. And for 2021, we identified 229 unique donors awarding more than $1 billion. Next slide. So of the $1 billion, 18% was explicitly designated as flexible support or unrestricted support. Community foundations in the data set awarded proportionately more of their dollars as unrestricted compared to other donor types. In aggregate, overall, on one hand, this 18% is a bit of a disappointment compared to 2020, when 43% of dollars were unrestricted. Mackenzie Scott's grants played a major role in that trend. She donated a vast amount to many organizations, the majority of which were unrestricted. So we took a look excluding her grants from the analysis. And in fact, in 2020, 8% of dollars were explicitly unrestricted. So compared to that in 2021, 16% excluding Mackenzie Scott was unrestricted. And so in that regard, it can be seen as an improvement that proportionately more COVID funding in the second year of the pandemic was designated as unrestricted. Next slide. Health, human service, and education organizations received the highest shares of dollars. These were the top three categories in 2020 as well, although in 2020, human service organizations received the most funding. The donors in this analysis were all US donors, but the recipients were not just organizations based in the US. We found that $224 million was cross-border funding, so directed to recipients based outside the US. But even funding to organizations in the US could have had an international focus. Organizations like CARE or the United States Fund for UNICEF, they have offices in the US, but much of their work is focused internationally. And we did see from grant descriptions that US donors were giving funds to fight the pandemic in India. They were supporting research in South Africa and really addressing the global nature of the crisis. Next slide. Among the recipients and work focused in the US and based on Candid's coding taxonomy, about 27% of COVID dollars was explicitly designated for ethnic and racial groups. The majority of these awards didn't provide details about specific identities. So when there were descriptions, they were broadly addressing racial equity or communities of color. And next slide. So finally, if you'd like to explore more of this data yourself, there are two free online tools you can go to. One is the Disaster Philanthropy Map we've built with CDP, where you can see not just coronavirus funding, but funding for all disasters and humanitarian crises since 2011. And the other map is specific to COVID-19. Both of these maps include data beyond what was used in this analysis, including grants from non-US donors. So I'll end there and turn it back over to you, Natalie.
Thank you, Grace. That was a really helpful overview of the data. And with that, we'll go to Regine, who's going to talk us through some more of the findings within the report, and specifically looking at kind of, especially as we look at 2020 and 2021, what's also coming in the future.
Thanks, Natalie. I'll echo the thanks to the folks over at Candid, the folks at the Council on Foundations, and the Irene W. and C.D. Pennington Foundation, just for the opportunity to work together year over year on this really important work, bringing data to life in a way that we wouldn't be able to do alone. So I'll just say thank you for that before we hit a couple more data slides. So I just wanted to share, first I want to share a little bit about what the Center for Disaster Philanthropy has been up to. And this is our this is our grant making in 2021. So in 21, CDP allocated $23.9 million worth of grants. And it's probably teeny tiny type here, but everything from 0.4% of that total amount going to tornado activity to 53.3% going out of our COVID-19 response fund. We had additional dollars that we granted out for wildfire recovery in Oregon, Washington, Colorado, and certainly California. And then the storm figure at 7.6% represents all of the hurricane-related grant making that we've awarded. But again, I just want to highlight that as far as our work was concerned, over 50% of all of our work focused on the pandemic. Next slide, please. This particular slide shows how we divided our grant making by issue area. And far and away, the greatest amount of dollars went toward vaccine access. And we're going to talk about that in a minute or two here. But it also went to capacity building. And that's a little bit akin to our kind of as close to unrestricted as we go at CDP. And often reflects, quite frankly, staffing, right? So providing that flexible support to have literally post-disaster, having a person at the other end of the phone who can answer, who can like pick up the phone, answer questions, point people in the right direction. That's oftentimes what we refer to as capacity building. You see a heavy focus for us on mental health, housing, and disaster case management. And again, we'll dive into that a little bit more. All the way at the bottom in this teeny type was water, sanitation, and hygiene, with about 10 or so different issue areas in between that are all critical, both from a disaster and humanitarian assistance strategy, but also very integral to the issues that we saw get exacerbated over the course of the 2 years of the pandemic, 2020 and 2021, right? I know I learned a new term in 2020 called newly in need, which was largely reflected through our food security grant making, in that individuals who had previously not suffered food insecurity now needed to access food banks, Feeding America resources, et cetera. So just an example about how every issue here we see in our usual disaster and humanitarian assistance work, but again, they were overwhelmingly exacerbated by the pandemic. Next slide, please. In terms of by geography, 53% of our grant making last year was domestically focused. Again, that's all of our grant making, not simply our COVID grant making, but our wildfire, hurricane, et cetera. And 39% plus that 8%, which equals, hold on, 47%, went outside of the United States. I think that's it for me for my slides, but I just wanted to take a moment to reflect future forward, right? So this snapshot reflected just the 12 months of 2021. And we started making our first grant in February of 2020 for the pandemic, right? And that our initial grant was for mental health services in China. And we, as an organization, we were off to the races in terms of our grant making ever since then. So again, thinking future forward, our team is now divided internationally and domestically. And so we started with a $44 million fund. That fund, as you can see, is no longer $44 million because we've made all these really exciting grants. So with the dollars that we have remaining to grant out on the international side, we have been very careful and very thoughtful about narrowing down to a 16 country list of regions that are threatened by conflict or pre-existing vulnerabilities such as drought or conflict, or refugee crises, complex humanitarian emergencies. And then we narrowed that. So we looked at the world through a number of different severity indexes, narrowed it down to 16 countries that we would focus on. And then the interventions that we're very specifically prioritizing right now are on the greatest current and future disaster risk, the most susceptible to COVID infection, and the least able to access quality healthcare. So you're already seeing us awarding grants into the Horn of Africa. You'll see us very shortly making awards into South Sudan and other areas that, again, that quite frankly have limited access to quality healthcare. And then in terms of our domestic focus, we are really very targeted on school-age children and youth that are suffering long-term learning loss and a lack of equitable access to resources and the lack of continued learning. We're focused on minority, immigrant, refugee communities of color and other marginalized communities where virus surges continue with little to no encouragement for vaccination or access to accurate and appropriate information and resources. And we're looking very carefully at domestic workers, healthcare workers, farm workers, food service workers, frontline workers, or those that are labeled as essential workers that are really suffering from what was laid bare by this pandemic. And then lastly, we're really focused on families that are struggling to manage their day-to-day lives, as equitable access to childcare remains a really, really significant concern. And so that's how we're balancing our domestic and international portfolio over the course of 2022 and likely a titch into 2023.
Great, thanks, Regine. Before we move to our next speaker, I just had one follow-up question, which was, you talked about the importance of funding vaccine access, mental health, and equity as three of the kind of leading themes or funding areas by issue. And I'm wondering if you could talk a little bit about why those rose to the top for CDP.
Yeah, and that's a great question. I'd love to talk about that. One thing I want to say right off the bat is in the second slide, I guess I did. You don't see equity as a discrete portfolio or discretely called out in that little bar chart. And that's because all of our grants are made with a racial and intersectional equity lens. Not one grant goes out the door with an eye toward what equity is and how our work can support historically marginalized communities and those that were made more vulnerable by systemic racism. That's a fundamental for us. So, oh, thank you to the person that said they love that. So I'll start real quick with vaccine access and say, I'll just repeat the stat that Lori said at the beginning. 21% of people worldwide who have received at least one vaccination are from North America or Europe. The wealthiest 30 countries that have just 11% of the world's population have access to 14 or 15% of the vaccines. And the converse to that is really quite troubling, right? And for us, vaccine access goes beyond providing actual vaccines or medical personnel, although that is critical, right? But it also entails mobile outreach for rural and hard to reach communities. It supports the development and translation of materials into multiple formats and languages. And it also assists in identifying and training community leaders who can educate their community members and build trust in the medical system. So that's what we mean, and that's why it's this integrated ball. Moving now to the equity piece specifically. Again, I don't think I'm breaking news here with the folks that are on this phone call or Zoom call right now, but from the very beginning of COVID-19's impact on the United States, it was clear that the pandemic was not affecting all races the same, right? Like, I'll just highlight one statistic here, which is that Black or African Americans, non-Hispanic persons had 1.1 times as many cases, 2.4 times as many hospitalizations, and 1.7 times as many deaths. That is reprehensible, right? And so as far as CDP's role in that, we really encourage grant makers and donors to intentionally approach their COVID-19 philanthropy with that equity lens, which really entails explicitly addressing the needs of marginalized populations that are disproportionately affected by the pandemic. Lastly, I'll talk about mental health. I won't lie, mental health has actually been a focus of CDP's for a very, very long time. We know that mental health is exacerbated by event-driven disasters, right? Your hurricane, your typhoon, your wildfire, etc. But the toll that this pandemic is taking on people of all ages, in particular the very young and the very old, is kind of I don't want to say unprecedented. We've used that word a lot in the past 2.5 years, haven't we? So I'll just say it's really terrible. So we, like I said earlier, we started focusing on our grant making on psychosocial health and well-being, and that focus has really continued across all of our funding cycles. The intersection of mental health and disasters is one of the most sensitive aspects of response and recovery work. It's also one of the least funded among philanthropic disaster investments. So recognizing that gap, we've granted more than $2.6 million just last year alone to address psychosocial health and well-being after disasters. And that comes in a variety of form. Again, case management, having bilingual mental health providers available, supporting NAMI, the National Association of Mental Illness, so that they can expand their phone line and really get out into communities to provide the mental health needs that are so critically needed. I'll pause there. Before you go to the next speaker, though, Natalie, can I make one plea?
Go ahead.
Okay,
Plead away.
this is my plea. COVID is not over. My husband is in quarantine right now with COVID. It's not over. We are double vaccinated and boosted and all of the things. It's not over. And philanthropy cannot treat it like it's over. We have to sustain our interest in the topic area and recognize that recovering from COVID, not that COVID's over, but recovering from COVID is a multi-decade proposition. It's not going to be over in 2023, right? Like the ball isn't going to drop on January 1st and everything's going to change. We're still going to have vaccine access needs. Equity is still going to be top of mind. Mental health is going to be huge. Learning loss is going to be huge. We have to, as philanthropy, stay on top of this and stay attentive with financial support. That's my plea, Natalie. Thank you.
Great. Thank you, Regine. All right. Tonia, let's turn to you now and hear a little bit more how the Greater Washington Community Foundation responded to COVID-19 locally here for me. I'm based in Washington, D.C.
Oh, awesome. Perfect. Thank you, ma'am.
Yes. So what issues did you all see and how did you address them here in our community?
Sure. So I'd start by saying that the theme for the Greater Washington region was partnership. And I am incredibly proud of how our philanthropic community came together. You can go to the next slide to really get organized, to invest cooperatively, and to listen to the needs of people in our community. Together, over 25 philanthropic entities contributed to and worked together to administer a $12 million pooled fund that was housed at the community foundation. We had generous donors who made investments or gifts from $50 to $1 million. We, like Regine offered, we also applied a racial equity lens to all of our grant making, and I'll just stop to share that this was not an easy conclusion to come to at the height of the pandemic, but it was probably one of the most important decisions that we made in all of our decision making. I've said that we probably shifted more in the first 4 months of COVID-19 than we had, we as a philanthropic sector, than we had in the prior 4 years. But we applied a racial equity lens to our grant making after much debate around speed, the sort of the challenge between speed and equity, and decided that we wanted to prioritize organizations that were not only just serving communities of color or people who were most deeply impacted, but also organizations that were led by people of color. And 57% of our organizations who were funded during the height of COVID were led by nonprofit leaders who were people of color. And then I'm really pleased that over the last 2.5 years, we've galvanized upwards of $80 million in what we call aligned funds at the community. And these are funds that have been set up by individual donors, corporate funds, funds established by local restaurants or healthcare providers. There was an arts fund collaborative that was housed at the foundation, funds by local government that we worked with them to both administer their grant making, to think about their grant making strategy, and to make important investments in our local community infrastructure. Go to the next slide. Just a few examples of some of these aligned funds, because I think that they are just important to add some additional color to the kinds of things that our other panelists spoke about. But we housed what we called through the Children's Opportunity Fund in Montgomery County, where, and again, some of this, it feels like ancient history, but it was just a little while ago in the grand scheme of things when low-income students, many of them did not have a place to access the internet or a place to go when their parents, who were frontline workers, were off to work. And so we created hubs throughout Montgomery County. It was supported by both philanthropic capital and local government capital, so that these students would have a place to be while their parents were working. We also raised about $3 million to support food access in Montgomery County, and we used that to leverage an additional $28 million. And not just direct food access, but really an investment in the entire food to sort of farm to table infrastructure, really engaging both farmers and restaurants and restaurant workers in order to make sure that people in the county had access to the much needed food resources in the county. Next slide. I think there may have been one slide that we missed. No? Let's just check. Yeah. Maybe one more back. All right, that's fine. So just in terms of total outcomes, and these are some of these are direct numbers that we've been able to pull from our reports, and others we are just kind of getting the numbers in now. But we estimated that we served over 400,000 people in the greater Washington region. About 5 million went towards PPE support directly. Instances we funded probably in every category that you can think of, from IT support to shelter, domestic service, domestic violence prevention, legal services. I'd say that probably the big headline in all of our work was around cash assistance as one headline, and around advocacy. We placed quite a specific interest on investing in the advocacy infrastructure, recognizing that so many decisions were being made during the height of the pandemic, and we just wanted to make sure that we used our policy tools to our advantage and to the advantage of people who were in need the most, to make sure that protections reach them, not just in the immediate term, but also in the outgoing period as well. But I'll spend just a few minutes talking about the cash assistance. I think that's on the next slide, please. We dispersed upwards of $50 million in cash assistance programs, resources over the course of the last 2.5 years. A lot of this was done through our partnerships with local government. A lot of it was philanthropic capital, and it shaped up in a lot of different ways. A huge portion of our demographics were omitted from being able to access federal relief funds. And so we were really, really keen to make sure that our excluded workers were cared for. So through partnerships with local government, we were able to get resources to those families. We invested in a number of cash transfer projects because it was the most efficient and the most inclusive and the fastest way to get resources in the hands of people that needed it the most. I'm really incredibly proud because in pre-pandemic, 2019, when the federal government shut down for about 35 days, we actually reached out to the Center for Disaster Philanthropy and had a few meetings after we came out of that crisis to begin preparation for what we knew would be another crisis. We had no idea that it would be a global health pandemic, but we knew that we needed to get philanthropy sensitive to, comfortable with the notion that getting actual money in the hands of people was a reality that we needed to face and really begin to figure out the infrastructure for it. So immediately following the federal government shutdown, we began to organize our peers in philanthropy to talk about it, to really work through what some of the nuances would be, who could be our partners, what would it look like. And it's amazing that, 12 months later, we were in a position where we had to put that infrastructure into place. And it really, again, proved to be one of the most effective tools and I would say innovations that we pursued during the course of the pandemic. I think this is our final slide coming up, maybe. This talks about our advocacy grants. Yeah, we were really keen to make sure that We invested in organizations who were already doing impressive work to expand the earned income tax credit, to make the budget process more transparent, especially in the state of Maryland, and accessible, and to really ensure that workers, especially hospitality workers who were displaced during the course of the pandemic, had a right to be reinstated as businesses reopened. I mean, these are the kinds of pressures, and again, it's a place where I'm incredibly proud of our sector, our local sector, where we were mostly focused on direct service, but we also had an opportunity to influence the policy environment. You can go to the final slide. So what does the future hold? I think it's interesting. A lot of things have kind of fallen back to business as usual. We took a lot of pride in simplifying grant applications and working in a coordinated manner in making reporting more streamlined. And in many ways, we've kind of gone back to some of our old bad habits. I think some things have stuck, like general operating, multi-year grants, as the data is bearing out. It's still one we have to work on. But I do believe that there's a greater propensity and interest in making sure that direct cash assistance remains top of the radar, and as it will remain an effective tool for us. We are really keen to help nonprofits, both anchor organizations and institutions that are smaller and grassroots organizations, to think about reserves and endowment building. Most organizations ran out of money. They just could not see themselves clear for the first 3 months of the pandemic, didn't know where the resources were going to come from. And we want to make sure that this is one of our preparation plans, is to build the endowments now, particularly for general operating support, to remove the stigma around it, so that organizations can function both now and prepare on a day-to-day basis, and be prepared for the next crisis, whenever it comes. And I imagine, and my hope is that the interest in supporting organizations, again, that are not just supporting communities of color, but are also led by Black and Brown people, majority staff, Black and Brown majority staff. These are typically smaller organizations that were off radar for a long time, but we got on radar during the course of the pandemic because of their reach to community. And I'm just expecting, and I know our commitment remains to investing in these organizations. I want to make sure that there's time for Q&A, so I'll end my remarks.
Great. Thank you so much. It was wonderful to hear about what this local response has looked like in the DC area, and just really impressive to see both the outcomes from an advocacy perspective, but also the ability to mobilize on direct cash transfers. So thank you for that, Tonia. So we're going to move to Q&A now through the end of the session. So as a reminder, you can submit your questions using the Q&A box at the bottom of your Zoom screen. But to kick it off, I'm going to start with Tonia and Regine, and ask the question from Connor Wolf earlier in the chat, which is, I would love to know more about how you systematize equity in your grant making process. Unfortunately, this need for equity is breaking news for many grant makers, and their research found that nonprofits led by people of color were more likely to face catastrophic cuts from foundations and grants during the pandemic. So how do you do it? Regine and Tonia, can one of you kick us off?
You want to go first, Tonia? I was going to say, right. This is a time to celebrate others' leadership. In my view, we benefit a great deal at the Center for Disaster Philanthropy from the leadership that's provided by the Trust-Based Philanthropy Project, by Peak Grant Making, and by some of the resources of the Council on Foundations. And we have always done our best to be as nimble and thoughtful as possible as we work to support historically marginalized communities. And having the resources from, again, Peak Trust-Based Philanthropy is really helping us up our game. And so I would look there. Anything to add, Tonia?
Yeah, I would say the same, and it starts with the decision. it starts with a decision to prioritize racial equity in your grant making and to remove stigma about the capacity, the absorptive capacity of smaller nonprofits to receive resources. I think that's a bit of a farce that we've gotten comfortable with that may not be necessarily true. They stay small often because they are not invested in a way that allows them to grow. But it starts with the decision. And the decision for us was almost all of the nonprofits in our region that are focused on sort of community development are supporting organizations, supporting communities of color. So that was an easy bar, right? The harder bar is, and how do you invest in those organizations that are led by people of color, recognizing that organizations led by people of color are less likely to receive or to benefit from individual donors because of social networks or the lack thereof. But the opportunity for philanthropy is a different opportunity. And I'll tell you that the moment we started investing in some of these organizations led by people of color, some of them often were smaller, or less well known, our funders followed us. Our individual donors followed us. And they continue to reap the benefit and continue to grow both their footprint and their impact in our local community. So it starts with the decision and the commitment. And as you say, Regine, the resources are there to be able to put them into practice.
Great. So before we move to a slightly adjacent topic, one follow-up question, which is just how do you define led by people of color, especially because nonprofits are led by a combination of leaders, their staff, their board, and that having a single leader of color does not necessarily signify always an organization-wide dedication to anti-racism. So how did you land on that and use that as a metric, Tonya?
Well, we made a decision. So again, we refined it, I think, a bit more over time to look at organizations that are majority Black and Brown staff, have a more representative board of trustees that reflects the community being served. So we've expanded it and refined it over time. But at the time, during the height of the pandemic, we really went for organizations that were led by a leader of color. Because for us, it meant getting to it. We were making some pretty fast decisions. And for our region, there's typically, more likely than not, a correlation between leadership, staff, staff characteristics, and a growing shift around board leadership. I think that's the place probably where many of us have room for some additional improvement.
Great, thank you for that. All right, Grace, I want to jump over to you. And there's been a question in the chat, and just building on that, in your research, you talked about how some of the funding was direct cross-border giving to causes and organizations in other countries. So what trends did you see, or can you tell us about support to different regions or areas of the world? Kind of what were some takeaways in that global knowledge, in that global data of the response to COVID-19?
I think the one thing that really stands out is that philanthropy sort of followed where the crises were hottest, or what the media was most reporting on. So there was, in terms of the cross-border funding, the country receiving the most money was India. And we know that that was kind of the place for the second wave of the pandemic, being really affecting India quite a bit. In South Africa also, I think, might have been second on the list. Yeah, I was curious to see that there were also sort of intentional efforts to fund the research activities of universities in South Africa. So it wasn't just the pandemic like immediate response, but it was sort of supporting other aspects that would impact the pandemic response. Yeah, so I think they tended to be focused on where the crisis may have seemed most urgent to U.S. donors. But yeah, I think maybe that would be my biggest takeaway there.
Great. Thank you so much for that. So 2 more questions, and then unfortunately we'll have to close. So the first for any of you is just a question around, many nonprofits sprung up during the pandemic in order to respond to new needs in communities. And a question of how do those new nonprofits start to access philanthropic resources? So what advice would you have for them of how to get connected to foundations who are still interested in funding a COVID response?
So I'll just offer that we didn't necessarily fund a lot of newly formed nonprofits. We did fund a lot of nonprofits for the first time, which was actually really exciting. And we did support mutual aid networks, and some of them were fiscally sponsored organizations or organized sort of informally, and we figured out a way of supporting them. I think that was the other place of, I would say, kind of an aha for the sector, that these groups formed and organized themselves, and many of them are not looking to grow into mega nonprofits. They want to continue to serve people at a grassroots level, and I think we, yes, philanthropy, have to continue to figure out how do we resource them in a way that helps us to meet our own goals and our own ambitions for community, or addressing community need. Let me just reframe that.
I can also just add that Candid has a variety of resources to support nonprofits who are small, or if you're wanting to learn how to even start a nonprofit. There are a lot of free learning resources that we have on our website. You can access at learning.candid.org, and also videos and past webinars that we've had. And one of Candid's sort of flagship tools is a grant seeking tool, where you can see how grant makers have funded other nonprofit organizations in the past, and it's a tool to identify potential funders in your area, both geographically, but also in your subject area. So those are tools that you can turn to Candid to find as well.
Absolutely. We use FDO all the time at the Council on Foundations. I know many of us do, to learn about what foundations are funding and where, to help guide all kinds of work. Great. So our final question is really to give you the space, if you'd like to make a plea like Regine did earlier, or offer a piece, one last final comment to attendees on the line about what they should think about as we are now in year 3 of pandemic response to close us out. Why don't I start with Regine?
I'm sorry, you're gonna like put the hook around my neck, but the pandemic isn't over. So again, I'll just double down on my plea to philanthropy for sustained attention, sustained financial attention, sustained support of your existing grantee partners as well as new grantee partners. Times are tough, so keep helping.
Great, thank you. Grace?
From the data side, I would say we would love for all funders to be data partners with Candid. So pleased that CDP, Greater Washington Community Foundation, they share their grants data with Candid, and that's what enables us to do the analyses that we do. So if we want better information, we just need better data. So yeah, would love to see funders share their data with us.
Great, thank you. Antonia, close us out.
Sure, I'll start I'll end where I started. Partnership. We can't do this work alone. It's far more inefficient and ineffective. And so the more that we can do together and in an aligned and strategic and thoughtful way, the better off we'll all be. And that we need to continue to figure out evolving practices and getting money and other resources in the hands of people who need them most, pre-pandemic, before there's a crisis, and especially during a crisis. Thank you all again for having us, and I appreciate being involved.
Great, thank you everyone. So in order to respect our time and keep this webinar to an hour, that is all the time that we have today. Thank you to Candid and CDP for this report. If you want to dig into the data even more, feel free to go to the websites that Grace shared earlier, or dig into the report itself, which has been shared in the chat and will be shared in the follow-up email as well. Thank you also to Lori, Grace, Regine, and Tonya for taking the time to share your insights with us. and help us dig deeper into what this all means. If you still have questions or thoughts that were not addressed during today's webinar, Tanya's contact information is on the screen here, so you can email her. She works with CDP. And I just want to end with thank you. Thank you all for the funders who are still funding the COVID response, for being willing to listen to what the data shows and think about how you can continue your support. The pandemic is not over, and we know many of us are still active in our response in different ways. So thank you all, and have a great rest of your week.